Right, so great question. So first of all, this is one of the most benign treatments, right? You have to realize that this is associated with very few side effects. And doctors who use it know that because, we don't get patients coming off medication. Discontinuation rates are very low. Adverse event rates are very low. There's no hypovolemia-related side effects. There's no hypoglycemia, very rare hypoglycemia seen, particularly in people who are taking it with insulin or sulfonylureas often can get that, but that's also very, very rare. So the most common side effect is, as we worry about, is sort of genital urinary tract infections. Now, that's a big word, genital and urinary. It's not genital urinary because there is no increase in urinary tract infections. We don't see that across the class. So it does not cause sort of urosepsis or UTIs. That is not the case. People with diabetes can get a higher rate of UTIs, and we do not believe that SGLT2 inhibitors are causal in that fact. Now, there's an increased risk of genital tract infections that are fungal infections. We know that occurs in about 1% of people, 2% of patients, sometimes mostly females, and can be easily managed. So 3 things: don't stop the medication, use topical antifungals or oral antifungal therapy for that. And usually people who've had one genital tract infection tend not to have subsequent genital tract infections when treated. And number 3, good sort of hygiene in terms of, genital hygiene, washing after urination and things like that can be exceedingly important in preventing that. But again, this was a lot written about diabetic ketoacidosis, but clinically it's something that we don't see very often, and it's not, as long as you prevent and avoid using it in sort of the high-risk groups, such as type 1 diabetes, where it's contraindicated, at least in Canada, and of course in people who are undergoing major surgery or people who are actually unwell and cannot take any oral intake, then I think you're probably going to be able to stay away from that feared complication. But this is a wonderful strategy that actually is associated with very little side effects and excellent tolerability across the board.